I'm Peter Block in Orlando at the AHA annual meeting for On the Scene, and we have talked about a number of trials having to do with hypertension, and I'm here with Bill Cushman he's a neighbor of mine from Tennessee. So, Bill, you have reported on the accordion trial, an interesting trial with diabetics to find out whether or not intensive or glycemic therapy, I should say, and antihypertensive therapy makes a difference. So tell me about the trial first off. What did you do? And then we'll talk about what you found.
Yeah. So what this is the long-term extension of the ACCORD trial, looking at people after we finish the intervention and then following them long-term to see whether there was a persistence of effect or anything new that would happen. So a so-called legacy effect.
Okay, so you have basically all diabetics, however, is that correct?
That's correct.
All right, all diabetics treated with antihypertensive and normal glycemic agents, some with high sort of intensity glycemic agents, is that correct?
That's correct.
All right, so having said all that, what did you find?
Yeah, so we were testing whether a systolic blood pressure of 120 was better than a systolic blood pressure of 140 in patients with diabetes. And some of them were in the more intensive or less intensive glycemia groups. So what we found was that overall there was not a significant benefit during the trial or in this extension of a total of about 8.8 years of follow-up of the participants, including both trial and after the trial. What we did find was during the trial, you may be aware that we found a significant benefit on stroke, but since that wasn't the primary outcome, then we didn't conclude that we had shown a benefit. So in this long-term extension, that stroke benefit tended to wane in terms of the overall effect, and so maybe that's what you would expect.
Well, tell me something, Bill. Do you think that diabetics are different? I mean, we think that lowering blood pressure more is important. Are there other groups in your study that actually turned out better?
Yeah, so it turns out that there was an interaction where those who were in the standard glycemia group, and so their glucoses were in the 7 to 8 range basically, they did show about a 25% benefit for the intervention of the blood pressure arm. So reducing blood pressure did what was expected and what we tended to see in many other studies. So a very nice reduction in cardiovascular outcomes in that subgroup, even though that wasn't the overall trial, but in that subgroup it shows that there's very promising results.
Well, it's sort of interesting, isn't it? We're sort of stuck between trials now that are telling us that lower is better, and every once in a while one pops up that says, wait a minute, maybe not so true. And maybe diabetics are different, and maybe it's a play of chance.
Yeah. So I think it's not probably that diabetics are different, because in many other trials we've seen benefit from blood pressure lowering in diabetics. And I think there may be some unusual interaction going on when we tried particularly to treat to very intensive glucose levels, which, as you know, in the ACCORD trial were shown with adverse outcomes. So I think that our results are probably consistent with other trials, particularly if you look in that group who had standard glycemia as their goal.
Still a lot to learn about hypertension, particularly in diabetics, but interesting results. Thank you for coming by.
Yeah, thank you very much, Peter.